All right. Hi, everyone. I'm Dr. Lazar. Thank you for joining. If you are joining via Zoom, just know that this is being live streamed on social media. And I'm really excited for Dr. Sarver to share this awesome information with you. He's actually sitting right next to me, but he'll be in the frame here in just a second. In fact, Dr. Sarver, why don't you join me on the screen here, and I'll introduce. So we have found a big correlation with people that are exhausted all the time. And so, there we go. All right, so people are exhausted is what we hear, right? They get up in the morning Absolutely. And they don't have enough energy to get through the day or what they're trying to accomplish. And that's a big deal. I mean, there are moms and dads and husbands and wives and business owners and employees and people that really are struggling to have enough energy to do basic things like get ready or go to work or be engaged in their families. Yeah. And it's a struggle, and people oftentimes think, well, it's just because I'm getting older, right? Or it's just because my hormones are off, or of course I'm exhausted, I have little kids at home or something. And so you have come up with some of the best work I've ever seen on how to test people, see what's going on, whether their adrenals are overfunctioning or underfunctioning or on their way to fatigue or on their way to exhaustion or on their way to shutting down and crashing. And that's really important because people, I think, are sick and tired of being sick and tired, at least the ones watching this. Yeah. And I also think that people are looking for solutions. I think they're sick of covering things Absolutely. Up, and sick of masking symptoms. And so I'm really excited. I'm going to turn it over to Dr. Sarver. He's a personal friend of mine, and we get to work together, which doesn't feel like work, but we get to show up and take care of people together. We do totally different stuff, but it's so cool when we are addressing the structural and the biochemical aspects at the same time. It's very powerful. So anyway, I'm going to turn it over to you. I'm really excited. We'll keep an eye on the chat and make sure people know what's happening. And then what I want you to do is just go through your workshop. And when you're done, if there were any things that came in, any questions that came in, or if you posed a question and Dr. Sarver doesn't get to it tonight, we'll make sure that we follow up with you for those answers. So I'm really excited. And here's Dr. Sarver. Absolutely. Thanks for doing this.
Thank you.
You want the comfy chair or you like that?
This is great.
Okay.
Thank you for the kind introduction.
Of course.
We're going to get going without any further delay. I really hope that this is beneficial to everybody, and I really hope that you can take action, because we can often gather information, but what we do with that information is so important. And I've seen so many lives that have been changed through what we do with our care here. And what we're getting to is cause. We're not just treating symptoms, because a lot of these problems are lifelong. So we're going to get right into the subject matter. And my slide advanced here. Okay, a little bit about me. I've been married for about 30 years. I'm the father of 4. Done a lot of extensive training with nutrition, masters in human nutrition, advanced certification in nutritional response testing. That's what the NRT stands for there. And I've been in practice about 31 plus years. And it's been just a fantastic, fast 31 years. And I am never going to stop learning. I enjoy this work so much. So when you've been told that your labs are normal and there's nothing that the doctors, the mainstream, can do, oftentimes they tell you, or sometimes I'm actually hearing that patients should go maybe seek psychological help, then patients are not really, really wanting to go on more medications. They're not wanting to go see a psychiatrist or a psychologist and get into more medications. They're looking for answers. What are the causes of the symptoms? What are the causes of why they're struggling with fatigue or adrenal stress, et cetera? So tonight's workshop, we're going to go over some of the symptoms of adrenal dysfunction. We're going to go into the causes of it. We're going to go into stressors to the adrenals. We're going to touch on some nutrients for adrenal gland health and assessment of adrenal glands. What we can't treat what we don't know about or what we don't test for. So that's why the labs and the NRT testing, I like to say the best of the East and West are put together into what we do here. So we're doing a functional testing with the NRT and the labs put together. So oftentimes patients will talk to me about functional medicine, but functional medicine is often just limited to labs only. So the NRT testing is bringing in much more accuracy and live one-on-one, more custom-made, definitely custom-made programs for the patients. And then we're going to go through and explain NRT a little bit, and then I'm going to get into a special offer here at the end. And then if there's any questions, please submit those on screen. If I can't answer them here, we'll definitely have a time for you to come in during your consult and the exam and answer those questions for you. So some of the symptoms, and a lot of you are very aware of adrenal symptoms, but exhaustion. So waking up, as Dr. Lazar intimated earlier, exhaustion from the time you wake up to the time you go to bed. Postural hypotension. Those patients that get up from sitting down or lying down and they feel dizzy. That's called postural hypotension. So if the adrenal glands are not strong enough, then they're not stimulating our body with what our body needs to change the blood pressure, the blood flow to our brain. In other words, we're just not getting the same reactive adrenal support that we were when we were younger. Ligament instability. A lot of people think, well, I just want to take some chondrosamine or something, and they're going back and forth, and it's a never-ending cycle, and they're winding up with a lot of joint issues many times with adrenal problems. Depression, salt cravings. A lot of folks that are adrenal dominant or adrenal hypoadrenal will have salt cravings all the time. Inability to cope with daily stresses, low blood pressure. So we can see the adrenals not taking their role in regulating blood pressure. Reactive hypoglycemia. Hypo meaning under and glycemic meaning sugar. So their body is reacting negatively after a couple of hours after a meal, or even sooner many times. So when they have food, then they get more energy. So we have a real stress problem causing the adrenal and the cortisol and the insulin reaction, which are regulated through some of the glucagon and cortisol. And all that balance is off to create the reactive hypoglycemic symptoms. Anxiety, big problem, often with the exhaustion and then sleep issues. A lot of these go together. Some of you may have several of these symptoms together. So the adrenal story, I've had a patient a while back that just came in, totally almost couldn't keep their eyes open during the exam. And they'd been suffering with this for a long, long time. So with the workup, what we discovered was that they had some key stressors. So we're going to get into the stressors later on during our talk tonight. Some of the stressors can be chemical, some of them can be food stressors, some of them can be immune stressors. This patient had 5 categories of stress, which were really downregulating their adrenal function. So long story short, they started to feel better after a few weeks of care, and they wanted to go clean the garage. They didn't really tell me, but they were going to plan to do all the extra work because of the extra energy. And then 2 days later, after garage cleaning event, they were down for 2 days. So a lot of folks that have adrenal exhaustion, they'll get an initial burst when the adrenals are starting to heal, but we have to really pull back on the reins with these cases and slowly work with not only taking the fire away, but slowly bringing in the carpentry through good nutrition and working in exercise and sleep regimens and lifestyle changes, which are going to give them a long-term success. Because a lot of these issues are chronic for years, even decades. So some of the factors that affect normal adrenal function. We talked a little bit about some of the factors. Stress, we'll have folks that will be taking a lot of coffee in their diets from early morning till almost the time they go to bed. A lot of it can be the stress of their job. Some of it can be emotional stress. A lot of these issues are coming from their environment. Perhaps it's chemicals that they've been exposed to, or heavy metals that they've been exposed to through maybe even dental work. And some of the heavy metals that are in the atmosphere, in the water sources, these are all factors, as well as some of the immune challenges. We see a lot of patients that come in with fungal and parasitic problems that really zap the adrenal function. So some of the nutrient deficiencies, and some of these are going to be determined during the nutritional exam. We'll find that vitamins B, especially B1, 2, and 6 are deficient. And oftentimes it will be a focused or 1, 2, or combination of these three, especially, which will help that adrenal patient. Vitamin C is really important in adrenal function, magnesium and manganese. So a lot of people have heard of magnesium, but manganese is more of a trace element or trace mineral, which we need to ramp up with a lot of these patients. A lot of times we're looking at a problem where the adrenals are just almost totally dormant because they've been so stressed. So we need to work slowly with some of these things so that the patient isn't suffering from any sleeplessness from the extra adrenal input. So we have to time what we're doing very, very carefully. Some of the toxins that we run into can affect. So what we do in our office is we work with a lot of the stressors via the testing. We want to find out. We can find toxins through expensive labs, but I tend not to want to use labs where we can use no cost testing in the office. In other words, included with the care here. So we have several different test vials, which will show us toxicities. Test vials, which can identify aluminum, we can identify chlorine, we can identify arsenic. Some of the things which a lot of people don't think are problems, like inorganic copper. So there are inorganic copper sources in bad supplementation. Perhaps you've bought something from Costco or Myers or the drugstore, which didn't have a copper that your body could digest. So that copper becomes lodged in the system and can affect the adrenal health. Or it can be even manganese. A poor inorganic manganese can really upset the adrenal balance. So very important that we're getting whole food sourced minerals for what we're doing. So toxins don't have to be the poisons that we often think of, as far as atmospheric hydrocarbons or poisons like pesticides, et cetera. We do find a lot of these things with patients, but toxins are often benign products that we don't think are harmful, but they do cause a problem when our body can't digest and handle, and the adrenals do suffer energy lag from the toxin input over time. So infections are often overlooked. So oftentimes we don't have what we call a full-blown raging infection, but what we see is a subclinical presentation. By that, I mean we see a retro, maybe virus, something like a virus that is under the surface that is almost like performing guerrilla warfare on our system. So we often see patients with viruses in that classification. A good example of that might be a herpes simplex virus, which is a class or type of retrovirus. So under stress, they're amplified and they manifest themselves with cold sores, etc. But there are a lot of different viruses, and we don't really treat the viruses particularly, but we work with your body's immune system from the inside out. So your natural killer cells, your lymphocytes, your white blood cells, all the factors that you were created with can help overcome whatever the immune challenge load is. We see patients that will come in with unknown parasitic overload problems. We don't necessarily have to see worms. We can see microscopic or bloodborne parasites. And those can be very zapping to the energy and to the adrenal function. So those are just a couple of examples. And some of the vials that we use here, can't really show you real close on screen, but these are some of the test vials and the different energies that are imprinted into the purified liquid within the vials, which are very helpful and very precise in showing us what's going on with you. And then we look at solutions once we find what the interference is. Food sensitivities. Oftentimes we hear patients say, well, I'm not allergic to. Allergic is really a big overstatement of food sensitivity. What we're looking for is often what your body is slowed down by or has a hard time handling, or your body reacts negatively without your having a full-blown allergic reaction. And so in this kit, I have 60 different common food sensitivities, which we check for. Some of them are very broad. So we have maybe nightshades, which is a classification of vegetables. And then we can narrow it down from there and see what you're sensitive to exactly. And then on follow-up checkups, we can see how your body is handling. Some of these foods can be reintroduced because some of them we want to bring back into our diet. Things like melon, maybe, which we really love to eat, or berries, etc., are not necessarily unhealthy, but that sensitivity can drag us back, can put the adrenals down with their function if your body is having a hard time with that sensitivity, at least for the time being. Not always sensitive, but once we get the immune status up, get the digestive status up that's associated with the adrenal function, then your body often says we can get those foods back into the system and we can process once again. So some of the glands or organs that are associated that are not thought of alongside of adrenal poor function or the adrenal malfunction are hypothalamus dysfunction, pituitary gland, and thyroid gland dysfunction. So in the world of hormones and of glandular and endocrine function, we often talk of the HPA axis. So that's the H is the hypothalamus, P is the pituitary, and A is adrenal. Now, thyroid is often talked of as a master gland. So considerations are often given to hypothalamic and pituitary thyroid gland function when we look at the adrenal glands, because oftentimes it's not just the adrenal glands that are suffering, it's the other glands that we have here, or organs that are suffering as well. So they're all working together to produce energy and balance in our system. And a lot of folks think of thyroid as being the only culprit with energy loss. Obviously the adrenals, but unknown to a lot of folks is that the pituitary gland outputs and controls a lot of what the thyroid gland and the adrenal glands will do. So that's very, very important that we see that on labs and also in the testing that I do in the office. So in the adrenal chronic stress syndrome, we have different phases. We have alarm phase. That's the first stage of stress. So that will be when you're on a trip perhaps, or you're in a strained situation, then your body amps up the adrenals, or when you're in the flight or fight, situation where you're wanting to run or fight in a severe stress stage. The adaptation stage is more of a longer term. Your body starts to try to adapt to stressors. And then when we have resistive stress, we have levels of cortisol, which are elevated. So we'll often see that on labs if we feel those are warranted. So those would be the more the hardcore adrenal issues. So folks that have long history of not sleeping well, and along with that, the energy loss. Exhaustive stage, we'll see the DHEA levels along with the cortisol levels that are really off. So these are phases that we bring in, and we're looking at to determine where you are with the testing, where that fits in, and it gives us a good idea of if this is going to be a fast fix or this is going to be a slow fix. So very, very helpful in knowing the history, and with the labs and the exam, we can determine where you are. So some of the nutrients that are often overlooked from the trace element or the actual nutrients: iodine, selenium, vitamin D, iron, zinc, vitamin A, very important for adrenal function. But I always say we like to bring in the fire crew. We like to put out inflammatory issues, as we talked about the stressors before. I call those the inflammatory stressors. The nutrients we're bringing in to work with supporting the adrenals after the inflammatory or the fire has been put out. So very important to do things in the right order. So the assessment of the adrenals, first we like to do labs. We like to see labs before I actually see you as a patient. So when you sign up, we're going to have you go online, and part of the process is obviously ordering the lab. So there's a fee for that, and the labs that we do are very, very specialized, and we get a picture of all of what's going on in you. A lot of doctors, a lot of offices will say, well, we're doing a complete set of labs. But what it turns out to be is maybe a CBC, which is a complete blood count. They'll maybe throw in the blood fats, so the cholesterol and the triglycerides, et cetera. And maybe they'll pull in some minerals to check the iron level, maybe, and some of the other normal factors which patients think about. Well, the labs that we do are looking at a broader spectrum, probably 3 times the amount of data that we get in our labs to tell us exactly what's going on within the whole orchestra of your body. I mean orchestra, meaning the adrenal glands, the hypothalamus, the pituitary, the thyroid, all the way down to a lot of digestive functions. So we want to make sure that you can absorb what we're doing. So you are not what you eat, but you are what you absorb. So I'll say that again. You are not what you eat, but you are what you absorb. So when we're giving specific tailored nutrition or things that are meant for detox, we want to make sure that we're addressing digestive function along with that, to make sure that the recommended supplementation or detox odes are being utilized at 100%. So nutritional response testing is a muscle testing technique whereby we can see where the weakness is, what the priority is, and then we test the patient with the priority. In this case, we're looking at adrenals, and we're seeing what stressors there are. So is it one of the things we talked about? Is it chemicals? Is it heavy metals? Is it one of the immune stressors? So is it viral? Is it bacterial? Is it parasitic? Is it fungal? And then we're looking at food sensitivities. Once all those things are addressed, then we're seeing if our score with the testing, the muscle testing, is where it should be. And then the patient is given a dosage of what each of these things that we're addressing should be. So if you're taking perhaps a detoxode, we have one that we utilize quite a bit called Spanish black radish. So the patient could read the label and they could take 6 a day, but that might be way overdosed for that patient. So typically we see that patients test for quite a bit less than what's on the label, because we're finding that when we match everything up and we use the right combination, the dosing is much smaller for what they need. So the demonstration of NRT, I am not doing a live audience right now, but typically what we're doing is we're checking through the deltoid muscle group, the patient on their back, and the stressors are up against them. So the muscle will go weak when there's a stressor, and when there's different organs and gland points that are pushed, that will go weak as well. And then we have a priority test to test what of the above organs or glands is the priority. We never want to go out of the order of what the body wants healed first or taken into consideration first. When we do that, then the whole constellation of weakness of perhaps you have 5 different areas that are weak. When we address the priority, addressing the specific stressors, then that one priority comes up to the maximum score with the testing, and then everything else in the system comes up to that maximum score as well. So if we have a weak adrenal gland, and we also have hypothalamus, and we have stomach reflex, and we have kidney reflex being weak, and the adrenals test as the priority, we're going back with the system after we found out what the priority the adrenals need, and we're rechecking the hypothalamus, the stomach, etc., to make sure that they're functioning up to that level as well. When we do that, we find that the patient's progress is much more speedy and much deeper, and it really lasts as we go forward, and we don't lose ground that way, and the patient does better, not from necessarily a fast healing mechanism, but we often see symptoms disappear quite quickly. But we're looking at the long term. We're looking at cellular regeneration. We're looking at tissue regeneration. So a lot of these things have taken decades to develop, and we want to make sure that we're not having that patient have a false sense of security and then jump off and start doing things the way they used to. We want to make sure that this is a in-depth and a deep healing for that patient going forward. So any questions? I really would welcome anybody that comes in, or anybody wants to email questions to us here at care@lazarspinalcare.com. And for tonight's attendees, I'm offering $100 off our complete package, which is the NRT testing, which includes a 2-day consultation exam, and then a report of findings with us talking about what we found. So it's about a 2-hour event between those 2 visits. And also we're looking at the labs together during those 2 visits. The labs are included with this price. So we get the blood work package, which is extensive, probably, as I indicated earlier, 2 to 3 times larger than anything most patients have seen. So tonight, instead of the normal price of $497, we're offering it for $397. We do need a response within the next 30 minutes for anybody that's interested in taking advantage of that. So email care@lazarspinalcare.com with your response that you're interested in scheduling and getting the blood work ordered. So care@lazarspinalcare.com is where you would go to get that discount and to tell us that you're interested in coming in and having that workup done. So we utilize a group of labs. LabCorp is the lab group that we use. So there's a LabCorp within fairly close driving distance for most patients in most communities, and we can help you find a lab near you. I belong to a co-op, so we pass on a lot of the savings to the patients. So the blood work is very extensive. our blood work is based on years of experience. It can be more of a cardiovascular, it can be more of an adrenal focused workup, but we're going to work with each patient individually from what the blood work shows us. So very, very important that that's understood. And then we have a multi-page printout also of the blood work and explanations of what the patient is seeing on each of the indices and how severe or how healthy some of the areas are as well. So that's very, very important to have the patients understand what they're seeing on the blood work. So I always say my best patient is the most educated patient, and they get the better results and the best results when they're really involved and they know what's going on. So that's why we like to give the patient all the information that we're finding so they can be involved in what we're doing. So I really appreciate your attendance tonight, and I hope I can answer any questions when I meet you. And to be clear again, if you want to schedule, call us within the next 30 minutes or email us rather within the next 30 minutes at care@lazarspinalcare.com. And I hope to see you, and thanks for listening and thanks for attending this evening.